Hi, everyone. Welcome to this month's Health Tech Entrepreneurs Meetups. Today's topic is behind the scenes startup success and everything you don't see. So today's speaker is Rachel Zayas. I'll introduce her a little later, but to start with, we can do our usual intros. So when I call your name, please introduce yourself. Let us know who you are, what you're working on. If you're looking for any help with something, or if you're able to offer help with something, this is a good time to let everyone know. So I will start. Hi, I'm Neo. I am the founder and CEO of Neurosonics Medical. It's a neurosurgical device startup. I'm also the vice president of business development at the MDC Studio, a startup studio building health and medtech companies. And I'm also an associate at the Verte family of funds, which is a small venture fund investing in high growth companies located in opportunity zones. So next is Joy.
Hi. So my name is Joy Levin. So if I tell you what my real job is, you'll think, why are you here? But so I'm a market research consultant by most of what I do. So I work with different companies and organizations to learn what customers want. And so I do work with some startups on customer discovery types of stuff. But the major reason I'm here is because I also facilitate a roundtable for TEDCO for digital health companies. We meet once a month, and it's really for people in Maryland. So Cheryl of MedAptic is one of our members of our roundtable. We meet once a month, and so I'm just always interested in learning about what digital health and health tech companies are doing. So that's it.
Great, thank you. Bill?
Hi, I'm Bill Hall. I am president, co-founder of Triangulate Labs. We're building a digital total body photography solution that runs in your phone and uses advanced computer vision to help scan the skin and track your skin over time and help catch melanomas earlier. We're just about to launch within the next few months, and looking for potential team members and and so forth. Everything from software developers to make our app a little prettier and nicer and more functional, to help with reaching out to more dermatologists and supporting them as they use our app.
Awesome.
Bill, where are you located?
Down near Boca Raton in Southeast Florida.
Okay.
Awesome, welcome. Gil?
I'm a retired rodeo cowboy who's had a very hard life. I'm trying to get into medical devices because it can't be as hard as riding bulls. I'm Neo's colleague also.
Yes. Yes, Gil is the founder and chairman of the MDC Studio. So he builds a lot of, so when he says getting into med devices, he's building a lot of med device companies at the same time. Jonathan?
Hi, Jonathan Klaus. I'm a registered nurse and actually now a consultant. I do consulting for some health tech startups. And then also content writing. So just here to learn more and see what's out there.
Wonderful, thank you. Cheryl?
Hi, I'm Dr. Cheryl Lohman. I'm the CEO and founder of Medaptic, an Internet of Medical Things company. And through the National Science Foundation Phase 1, we have gotten 2 prototypes. One is for a pill dispenser that goes in the hospital at the patient's bedside, so they can authenticate to this Internet of Medical Things device, push a button and get their as needed optional medicines without needing to call for the nurse. So the value prop on that is it saves the nurse time, and with the nurseage shortage, that's important. It writes to the, well, it doesn't write, but the nurse's medication administration profile gets updated with the medications. And then the patients get their meds faster, which we think will lead to better hospital outcomes and certainly better patient satisfaction. So that's product one. The other product that arose out of that is for, say, cowboys who were had their front teeth knocked out, say, for instance, and now have like inserts that they have to put in denture holders. This is actually from the Mayo Clinic. This does not fit in the bedside table. So these things often go missing. And while it's helpful for a hospital, it's also for home use for folks that have dementia, just in case they can't remember where the remote control is. Then you could also put your glasses here. And voila.
Oh,
Telemedicine, or if you're my dad, quality of life, watching the Packers game, right? So this is probably what's more of interest to the DC tech stars that are coming into town here. And I've gotten some positive feedback for them, and with funding, then I'll definitely be looking for business folks to join this. I can sole source, non-competitively sell into any government agency having finished a phase 1 SBIR. So that's a huge competitive advantage. And, looking for people who can help me along with this. I'm an engineer, I'm a medical doctor. I need help with software, doing back-end writing into the EHRs, possibly with FHIR, but probably HL2 or HL7 V.2, and also the business end. Thanks.
awesome. Thank you, Cheryl. Natasha?
Hi there. I did marketing for 10 plus years and recently switched into full stack software engineering via bootcamp. So I'm a new software engineer, and the full stack app I made was definitely focused around kind of helping people with contact dermatitis, allergic dermatitis, avoid products that they are allergic to, which but basically it made me realize that I really care about health tech. And so I'm just here to kind of see what's around.
Awesome. Thank you. Welcome. And I'm going to skip Rachel for now. And Wayne.
Evening, Wayne Sternberger. I
Yeah.
am co-founder, CTO of Bloxanop, a recent startup. We're commercializing a neural blockade monitor. And actually, I think Gil had it easy with being a rodeo cowboy. I herd a lot of cats in trying to get this business up and running, and also keeping our research associates busy with tools to do data collections. So my ask would be, hopefully we'll be receiving funding for an NSF SBIR phase 1 in the new calendar year. And there are two things: as onerous as the proposal writing and answering questions rounds are, just getting up and running to support NSF, the fiscal aspects of it, the reporting aspects of it, et cetera. I'm always looking for insights about how to smoothly do that. But the other is that we'll need some engineering assistance support. So I'm looking for part-time engineering support.
Awesome. Thank you, Wayne. So now I'll introduce Rachel. So Rachel is the founder and CEO of Diagnostics, a company developing diagnostic tools for early detection of liver disease and liver fibrosis. She's a geneticist by training, and her career is at the intersection of genomics and entrepreneurship. She earned her Master's of Science in Biotechnology and Business from American University. She was an adjunct instructor at George Washington University teaching business classes, and she was previously a fellow for 757 Accelerate, Halcyon, and Healthworx. So now she's going to share her startup journey. And so I'll hand it over to Rachel.
Hello, good evening, everyone. Nice to meet each of you. First, I just have to start off and say, Joy, I think that after your intro, it seemed as relevant as anything that a lot of individuals on this call have gone through ICOR, if not some form of customer discovery. And that's just, it's so critical to my journey and my company's story and where we are today. And I'll go a little bit deeper, but I also teach ICOR classes now. So it does come full circle.
Oh,
But
good.
yeah. So okay, I'll start in chronological order and go from there. So about a decade ago, I was working at MIT in cancer research, and we were developing a nanoparticle that could navigate the circulatory system and target very specific organs. And this was focused on oncology, and I had a lot of fun in the therapeutic space. And I was there for about 3.5 years. I started there in undergrad, and I stayed there for a few years before deciding to determine where I wanted to go next with my career. So while I was there, I was pondering if I wanted to go for a PhD or do something else. And just the PhD route just seemed like the most obvious. It was what all my friends were doing. It was either PhD or MD track. That was the only two options that I knew. And I didn't want to be a physician. So I was like, okay, I think that the only option I have is a PhD. But when I was at MIT, I realized that we have all of these very savvy tools, and we use them routinely. And I realized that they weren't getting translated well from the research lab into the clinic. So I'm like 24 at the time, and I had never taken a business class. I couldn't speak any capacity of business language at that time. And I was like, you know what? I'm going to go to business school and get a dual master's in genetics to continue that aspect and an MBA. So I came out to DC a little over a decade ago, and that's where my entrepreneurship journey began. So I started my first biotech company in 2014, and that failed after a couple of years. It was also a diagnostics company, and it was launched out of American University with a few colleagues and a few peers. If this was more recent, it probably would have worked out better, but it might have been ahead of its time, and we were too young and too naive to know what we needed to do to get it to the next stage. So what we were developing was a kiosk where you could come to a kiosk when you were feeling sick and spit in a tube, and in 15 minutes we would tell you what respiratory infection you had. We started with the top 15 respiratory infections, and again, this was 2014, 2015, so many years before COVID was even a problem. But that failed, and I'm actually really thankful it did, because as many of you know, in the entrepreneurship journey, you learn a lot more from your failures than you do from your successes. It was the wrong team. Although we went through iCore, we thought we had a good understanding of product market fit, but it was just a little lost there. So wrong team, wrong market opportunity, and we weren't able to execute. So after 2 years of that, I left, and I decided to start Aged. So in 2017, I spent about, 12 months just reading through articles, trying to understand where the trends were in diagnostics. I knew I spoke the language of diagnostics, so I wanted to stay a little bit into my comfort zone. So we were very fortunate because we got a grant from the National Science Foundation very early to go do NSF iCore. And before we started iCore, we had the hypothesis that viral oncogenes were the biggest contributing factor to various cancers, and that physicians struggled with identifying who was carrying viral oncogenes. So patients with hepatitis B, hepatitis C, human papillomavirus, and so on. So we almost, and we're thankful for the iCore program from that early stage, because it truly humbled us. So we went out and we were at a conference, and we were talking to a series of OBGYNs, and we would ask, how do you currently diagnose human papillomavirus? And they would say, these are adequate, these are sensitive, these are specific, these are functional. We don't have a problem with diagnosing HPV. So we said, okay, this probably isn't our customer. Then we went to a hepatology conference, and we were asking about hepatitis B and hepatitis C virus. And yes, there are some challenges identifying patients very early, but then we learned that, well, it's a problem. The diagnostic tools to detect these viruses are pretty well defined. So we said, well, what do you have problems with? And we were at a conference, I think it was at MD Anderson in like 2018. And there was a transplant surgeon there who said, well, the biggest contributing factor to liver disease is NASH and NAFLD. And we're like, well, what is NASH? And I had never heard of it before 2018. So he said, well, this affects 1 in 3 Americans, and there are no non-invasive diagnostic tools, and the only way to diagnose is through a liver biopsy. So we're like, okay, tell us more. How do you currently diagnose? And he said something very compelling. And he said, well, liver biopsy is the standard of care. The true way that we diagnose is a disease. This is a disease of exclusion. So I said, well, what does that mean? And he explained that like as a physician, you have to rule out every other form of chronic liver disease in order to say this patient probably has NASH or fibrosis. So that was the aha for us where we pivoted. We really wanted to stay, or we really started with viral cancers and detection methods there. And by going out and talking to customers and listening to them and embracing pivots, we ended up here in this space, a space that we really didn't have much knowledge on at all, but we had a deep understanding of different diagnostic methods that we could develop. And we really allowed the business model to drive the science, not the other way around. So I think that that's something that has really equipped us well for success in the long term, because a lot of our decisions, if not most of our decisions, are driven off of what the market says and needs. And we generate a lot of hypotheses even today. So I think since then, since 2018, we've probably spoken to over 600 key stakeholders. Of course, not all physicians and anymore, because it's important to diversify who you're talking to understand context of use, how to scale, things of that sort. So we started with physicians, we went to health insurers, we went to different chief medical officers at different hospital systems to really understand where are the problems, how is it going to get incorporated, who will pay for this, how does that work, how does that function? And that led us to this space here today. My early journey within the NASH space. So what we did was for about maybe a year and a half, 2 years after we made that pivot, we scoured the globe for different open source data sets. So we contacted different researchers at NIH and the European Bioinformatics Institute, and we asked if they had any public data sets, public or private data sets that we could get access to. There are different data sets that you could just go online and apply to, but we're like, well, let's just take it a step further and see if anyone would be willing to share any anonymized data. And there was a handful of people who did. So what we did was we spent 24 months building out our pipeline in a very cost-effective manner. So instead of doing all of these whole genome sequencing assessments ourselves, we pieced together what data others had, and that's how we started to build our pipeline. So, each of the data sets wasn't the same, and it's nuanced and it's imperfect at best, but what that did was it showed that our tools were at least functional on the liver. And that mattered because as many of you are in the medical space, it's really a chicken or an egg scenario where it's like, well, how do I get started without capital, but how do I get capital without at least some proof of principle? So that was very helpful because by using both open source data sets and just some anonymized data sets to show, hey, this works on the liver, this is more functional than other types of genomic sequencing or proteomics that are occurring in the clinic today. That was the aha. So that's what we used to talk to investors and get into accelerators and show hey, we actually don't need a lot of money to go very far. And I think that one thing with the I-Core method, with the lean startup method, we've really taken that to heart at every step. We try to do micro studies and informed decisions that say, if we don't need to do this in 100 patient samples, let's do this in 12 patient samples, see what data we can get in the next 4 weeks, and then we'll make an informed decision. So I incorporate that into our design in many capacities, because, you know, when you're developing a technology, and especially as scientists and innovators, like there's 20,000 questions you could ask. And of course, like you can't boil the ocean because you need to stay focused. But what you can do is have a series of mini experiments that are cost and time effective in order to get to those next stages. So those early assessments using the Bioinformatics Institute, both from NIH and the European Bioinformatics Institute, really helped us get in the door early. Let's see, I'd applied to Halcyon, I think twice before I got in the third time. You know, there's definitely a lot of failures in this. You know, like the first time we didn't even ask like why we didn't get selected to even pitch. We were just like, okay, that's a shame, move on to the next one. And then we applied again a year later and got denied again. But that time I was like, you know what, I want to be curious as to why we didn't get it accepted. So I asked if they could just provide a little bit of feedback, and, you know, like, and they did. So I think that if anyone is looking at accelerators or grants or investment opportunities and it's a no, put your curiosity hat on instead of saying like, oh, well, this was a waste of time, or, oh, like we tried, we'll move on to the next thing. Like, take a pause and reflect, because I think sometimes when you're getting no's, there's often a reason, even if you don't know. And most of the time, somebody will tell you and be honest and transparent. And if they don't, the worst, like that's the worst, or that's all there is to it. Like, there's nothing to lose by just asking for just a little bit of feedback. And sometimes you're like, I totally disagree with that perspective. But other times you're like, that was a really good insight, and I'm going to incorporate this into the next pitch or the next application or the next grant. So
Tell us a bit about what Halcyon is, and I love to learn about the other accelerators you participated in.
Yeah. So Halcyon is a social impact accelerator here in Washington, DC. And they accept, usually for their flagship program, they accept about 6 to 8 companies, and you live in the house for 5 months. And it's intensive programming where you have skill series, pitch sessions. They equip you with a team of lawyers and consultants and mentors. So you are literally immersed in the startup community, and it's definitely a peer-to-peer community as well. So like, for example, when I went through it, and for context, each of us are social impact. And, you know, a lot of people say, well, what does that mean? And that was one of my first questions at Halcyon as well. I was like, what is social impact? And how do I adequately measure this? And the response was, it's what you define as goodwill in this world, as long as you could put a metric to that. So I said, oh, and at the time we were still focused on liver cancer. So I said, well, you know, by saving lives and catching cancer early, this is our ability to do good in the world. But one big thing that I found through Halcyon was that, you know, none of us were in the same space, not a single one. And for example, like one of my really closest friends during the cohort, her name is Chloe, and she's a toy designer, and she was developing toys for refugee camps, because oftentimes at refugee camps, they can't buy expensive equipment because they don't have the funds to do so. So she was creating these small toys because children are often left out, and this has impact on the societal level in many facets. So her and I couldn't be more night and day in who we're selling to, what our impact is, like what our strategies are. But regardless of that, we're speaking the same language. We need to pitch, we need to provide value, we need to talk to customers, we need to get in front of investors, we need to have long-term tracking. So truly, like, what I've found through Halcyon is that, like, we are often speaking the same language, even if it's in a different industry. So that was very helpful. another thing through Halcyon that I didn't even know was a thing. And I can speak further on this. They equipped each of us with a leadership coach. And on day one, my leadership coach said, hey, like, can you put a list of things that you would like to focus on through the next 5 months? And I was like, let's focus on FDA approval, clinical trial design, and payer reimbursement. And she's like, that's not what we're here for. But I had never heard of a leadership coach before that. So we focused on mindfulness and meditation and just learning how to incorporate breaks into the daily grind of our day, learning to unwind. And it's something that's really stuck with me through the years. I went through Halcyon about 2.5 years ago. So it's been a few years, and I was pleasantly surprised to learn that this was probably the most impactful aspect of my time there, because, you know, like, we really glorify the hustle a lot as entrepreneurs, but even if you're, it doesn't matter what stage you are, like, you're person first, and your needs and your basic needs need to come before your company, because you can't show up and be present and lead and work well with others if you're not the best version of yourself. So it gave me the opportunity to just learn about pausing and taking breaks, and that was a really good opportunity. So I recommend, if anybody has never done leadership coaching, to consider it. Or there's a lot of different meditation and mindful apps. It sounds small, but it's just it's a big change. So it was something that has really impacted my journey as an individual as well as a leader. So that was a big takeaway from Halcyon. And then during Halcyon, I was the Healthworx fellow. So I worked with a team of expert physicians and regulatory consultants from CareFirst BlueCross BlueShield. So that was helpful because we got to get firsthand experience from the payers who are making the decisions, because oftentimes, like, even if you've done customer discovery and you do really well-designed clinical trials, if you and you can get FDA approval, but even if you get FDA approval, it's not always in alignment with what the payers need. So you need to make sure you're engaging them often and early, and actually truly at the same time as when you're applying for regulatory hurdles, because they're the ones that are going to make or break your business. Like, you do not have a sustainable business model if the payer doesn't see a need and a use for whatever you're building. So that was really helpful and illuminating. And I essentially, like, worked with my advisors from CareFirst as if I was going into a customer discovery call every week. So I would come out with a list of like 5 or 6 specific questions, and we would dive. And I'm like, well, who makes the decisions for new tools? How often? How do I get in front of this person? What do they read? How often do they read? So it was a lot of fun working with them, and I got a lot of use. And I think they had fun, because I would always come with 20 questions, and it would be some good conversations. And yeah, so that was Halcyon in a nutshell. I'm sure it's like fine if I just keep rambling, but does anybody have any questions about Halcyon or anything I've said so far? If that's okay to pause.
Yes, please feel free to jump in with any questions you have for Rachel.
Rachel, could you talk a little bit about the status of your company, where you are? I looked at your website. Where are you? And you have an interesting looking team. I know this house very well. I used to live in Georgetown, where you are now. So that sounds interesting, but I'd be more interested in learning about your company.
Yeah, definitely. So we just finished the first of 2 pilot studies. So we're developing 2 tools simultaneously. One is a tool that can differentiate the benign from advanced form of liver disease. and then a second tool that can stage liver fibrosis. So the reason why we're developing both simultaneously is because if a patient has liver disease in the presence of advanced liver fibrosis, it accelerates complications by up to 80%. So it's clinically relevant to be able to diagnose both, and there's no effective non-invasive tools for either. So we just finished a pilot study in 24 patient samples to determine if we could differentiate the benign from advanced form of liver disease in patient blood samples. And it was really promising. We identified about 525 biomarkers that could differentiate between these controls. Again, this is a small study and it was intentionally small just to ask a question to say, is this functional? Should we go forward with this? And what data do we have to support that? So we're replicating that assessment for liver fibrosis tools. So both of these are whole genome sequencing methods. We're looking at the entirety of everything in the blood. And we'll be starting our second pilot study in just a couple weeks. So that will be determining if we can differentiate mild from advanced fibrosis. So these two pilot studies are not to select the candidate biomarkers, but rather show like this is functional for both of these tools. Let's go ahead and go forward with a larger sample size. So we're in the middle of raising about a $2 million seed round. We have about 70% of that committed so far. We think we're going to close by either the end of the year or early next year. But we have some good traction, and the data from our pilot has definitely helped move the narrative along and move the interest along as well. So it really speaks to just doing these small studies that would be nice to say quick studies, but as everybody knows, through COVID, everything has just really been slowed up. So that brings us to next year. So next year, we're going to expand the sample size to about 450 patient samples. And this will be for test method verification and biomarker validation, because with fatty liver disease and liver fibrosis, there are a multitude of underlying causes. So it's diabetes, obesity, metabolic syndrome. Children with diabetes and obesity compared to adult with diabetes and obesity might not have the same concentration of biomarkers in peripheral blood. So what we want to do is very intentionally recruit these different patient populations to make sure that our claims are adequate in these diverse patient populations. So we're working with different pharmaceutical companies to get access to these well-defined and well-characterized patient samples. And that has actually saved a lot of costs, because per patient, it would cost somewhere between $1,000 to $3,000 to get a few tubes of blood. And a lot of these pharmaceutical companies have been either have retrospective or prospective collected samples. So we're determining who we're going to collaborate with for the larger study, but we have some promising leads, and we're just in negotiations with a few right now. So that's where we are. And so by the end of next year, we'll have test method verification and validation. Then we have 2 more steps before we can actually reach market launch. So after next year, we'll do a small clinical trial at Virginia Commonwealth University, as well as at Georgetown with some of our collaborators. It'll probably be somewhere between 500 to 600 patients and last about 6 months. This is not like a clinical trial for a therapeutics company. We don't need phase 1, phase 2, phase 3. We just need to have a critical number of patients to show that the tools that we've identified have efficacy in a large sample size. So 500 is what we are aiming towards. If we can do more, that would be great, because I would like as much data as possible before we apply for payer coverage. So next year, we'll expand the sample size, and then we'll do a 6-month clinical trial. And while we do that clinical trial, we will gear up to apply for payer coverage in the DC, Maryland, Virginia area. So we expect to launch by 2025, end of 2024, hopefully.
Where are you doing the sample analysis? Are you building a lab, or are you using someone else, or?
Yeah, so to date, we've outsourced our sequencing assessments to Somagen in Rockville. They are a contract research organization, but going forward, we're looking at different scenarios. So we are this is new knowledge to us, but we will probably be moving into a lab at the Henry Jackson Foundation, which is right outside of Walter Reed. And while there's not a sequencing core there, we will have access to a lab there. So we could at least do the extractions there. But the way that we operate is as a bioinformatics entity. So our team is comprised of mostly geneticists and bioinformaticists, and we outsource a lot of and we outsource all of our sequencing assessments right now, but that will change in the coming years as we get a little bit closer to our next stages of development.
I've got a question. Wondering how you and your team learned the ropes of setting up and running clinical trials.
Yeah, that's a great question. So one of the big things we did that we were very keenly aware of was that we are like nobody on my team is a physician. So what we did was we were very intentional with recruiting a medical advisory board of individuals who have done this, are well savvy and well versed, and have access to both patients, CLIA approved labs, and are the decision makers in the hospital systems that they work in. So I spent a long time just going to conferences and figuring out the lay of the land and who is good to work with, who has not just good credibility as a physician, but also just has been spoken highly of from their colleagues, who gets things done in a strategic manner. So we have built a team of medical advisors who are really, really hands-on and have done this and can provide just hands-on insight for every step. Thank you.
I have a question. So when you took that year between your two startups to just do a lot of dive into the background research, did you give yourself that time limit, or how did you decide on that?
Yeah, no, I don't know if I sought out and said, okay, I'm going to spend a year, but it was kind of like, I think like the timing just spoke to me, where I was trying to get the nuances down, go to conferences, get a good indication. So I was a little bit older and a little wiser. I probably would have been more strategic, but yeah.
Awesome.
Rachel, are you physically located in Maryland, or is your company, or are you in DC proper?
So we just established an office space in College Park, and then we're going to be establishing a lab in Bethesda in a few weeks. So we're physically in Maryland.
Thanks.
Yeah, and actually you asked a great question, especially because this is a health tech meetup. If anyone is not familiar with BITC, which is spelled BIITC, is the biotech incentive tax credit. I'm missing a word in there, but long story short, if you're a biotech company dedicated to research in Maryland, you can get up to 33% back, cash back to your investors. And then if you're a biotech company in one of their opportunity zones, you can get up to 50% cash back to your investors. So it almost sounded too good to be true. Some of our investors were like, I don't believe this, but one of our board members had done it multiple times. So we knew it was well vetted, and the application process was extensive for the companies themselves, but definitely worth it. So if anybody is a biotech company in Maryland, the application for BITC just closed a few days ago, but they open every year, and last year, like, they didn't run out of funds for months. So it's just something to be aware of if you are in the area.
Rachel, do you know how they define biotech for that credit?
Yeah, I'm not the best person. Oh, sorry. Go ahead.
No, I was laughing because Sue Carr, she got her company certified. It took her a lot. It's my understanding that it just boils down to, does your product have to go through the FDA? Is it any more complex than that?
Yes, yes, especially because 95% of like diagnostic tools are not FDA regulated. So it's not just FDA, but rather like they have like a long list of what a qualified research and development could be attributed to. We went back and forth for a long time talking about how bioinformatics and computational genetics are considered research and development. And they're like, well, you don't have a lab. And I'm like, well, we don't need a lab because we're subcontracting out to the lab, but we're definitely creating value and we're creating jobs in Maryland. Some vague terms, but it sounds like they're willing to work with you as long as it's focused on health tech and wellness.
Thanks. Question, the Bioinnovation Conference is coming up next Tuesday and Wednesday, I don't know, but next week. Who's planning on going here? I am. Anybody else? No? Okay, well, I don't suppose we'll get together for coffee then, but maybe some other time.
Rachel, what group were you working with in College Park?
So I just have an office space in College Park. It's not affiliated with the university. It's just an office space.
Okay. Yeah. And Henry Jackson is not in an opportunity zone, as I recall.
No, it's not. You're correct.
MDC is, by the way.
MDC. Okay. Thank you.
We've gotten the enhanced tax credit once or twice. Neo knows about that.
Yeah, so you also had to deal with the definition of biotech, right?
Yeah. Yeah, I know you like Georgetown, Rachel, but downtown Baltimore.
Oh yeah, I haven't been in Georgetown. Well, I'm still there sometimes, but the program ended about 2 years ago, so got some good connections there. But I'm open to different places.
Okay. Let's talk sometime.
Okay, thank you. So,
oh yes, go ahead.
I was going to say, if there's no other questions, I wanted to put at least 3 types of advice out to everyone, and we can, if there's no questions after this, happy to talk and discuss. But I think when like advice to early or any stage companies, here are the 3 things that I think are really important. First and foremost, customer discovery will make or break you. So if you are serious about making an impact in your field, you need to do customer discovery and you need to do it very intentionally. I strongly recommend going through I-Core. If you're anywhere in close to a medical device or in the life science space, you really need that structure. It is so critical. And to embrace pivots through that, because it's okay to be wrong and humble in your pursuits. Second, but of equal importance, something I didn't talk about, but I could talk about for a long time. I was actually on a panel a few weeks ago, and we went on for this for about 2 hours. Like hiring and firing is really hard, but it's a lot easier to know who to attract and who to work with if you are very intentional about what your core values are. And it seems like something that just you might want to spend a weekend on, but I would caution against that, because like who you are as a company and what your values are will attract the right or the wrong people. So you need to be very intentional about what your core values are and use these as accountability metrics for who you're working with and if and how they should stay in the company to drive value. And then last but not least, my third piece of advice, this one probably won't come as a surprise, but is to prioritize rest. Like we all need a break, and we can't go 24 hours a day, because in order to be a good and effective leader, you need to be present and actually there during the weekdays. So you need to prioritize rest at night, get a good night's sleep, do what is important to you, whether that's working out or meditation or reading or turning off your phone and your computer. Do what speaks to you, because if you're going to be a leader and you're going to be an effective leader, you need to show up. You need to show up both for the workday and for rest. So those are my three big points.
Thank you so much, Rachel. There are many good lessons learned and insights there. We've got about 10 minutes. Does anyone have any other questions for Rachel?
I'm just curious about whether your takeaways are prioritized.
Oh, like between the three? Customer discovery, number one. Nothing else exists until you've identified a product market fit.
Rachel, I'm happy to say I've been through iCore myself for the company and done a lot of customer discovery. Even within the last 2 weeks, 100 people have looked at and tried to use that product. I just got it in, the prototype. So got that. But trying to attract people, as you know, I was asking for people at the beginning and trying to generate leads and trying to figure out what you mean by defining core values to attract certain people. And then basically you said have metrics to see if they're actually coming in line with those ideas. Thanks.
Yeah, so long story short, because we definitely don't have the time to get into it, but a few years ago I had to fire my co-founder, and he definitely checked a few boxes on our core values, which are being intellectually curious, exothermic, and I defined exothermic as leading through emotional intelligence, among several other things, but he wasn't able to lead strategically. And had I been paying attention to that, because that is one of our core values, I would have said he is failing in this. And because he's failing in this critical core value, he is holding back the potential of this company. So yes, you need to think about these things intentionally early on, but even when people are working for you as well, because sometimes you don't know that individuals that you're working with are holding you back until you miss a really big opportunity. We missed almost $1 million. We did miss $1 million opportunity about 1.5 years ago because I hadn't fired him. And that's what happens when you let people stay on too long. And I take full responsibility for that. It's not his fault that we lost that opportunity. It was mine, because he shouldn't have been on the team at that time. And that's really hard because you care about your employees and you want to see the best in people, but not when they're undermining the core values of your company. So you need to be honest with yourself and the rest of your leadership team, even if that's your co-founder, even if that's one of your board members. You need to lead with eyes open and be able to make these tough decisions, because if you don't, they will catch up to you. So try to learn from experience. So.
Ooh, sadly, been there, done that too. A friend of mine had to leave the company and lost $1 million, basically the phase 2 out of the NSF because of the team situation. I'm happy to report I ran into him this morning again at another conference. We run in the same things. We are still friends. So that was a massive win at the end of the day. But finding a co-founder or an executive team, they say, is like getting married. And I believe that. And to find a marriage partner or a business partner is not so straightforward as just putting, an ad on Craigslist. And I think that it's really, I'd like to see something in Maryland to increase the chances of being able to find people locally that have the synergies and the skill sets and the values to work together. Does anybody have any ideas?
Well, one thing, just to speak on one of your previous points, with our medical advisory board, so in the next year or two, maybe in the next year, we'll be hiring a chief medical officer, and that will be internal. And, you know, like these decisions don't happen overnight. And I like to bring everybody on as a trial period. So if you're going to work with us in any capacity, you come on for 3 months. And if at the end of the 3 months, it doesn't work out, I'll tell you why. And I'll be as transparent and we can go from there. But it's the same with our medical advisory boards, where I say, you know what, there's going to be a 3-month trial. Let's see if you can add value and if we work well together. Because if we don't, we should both move on. So that's how we vetted some of our medical advisory board members. And that's how we're going to vet our chief medical officer going forward. And of course, like, they're aware that it will probably be one of the 5 internally, but, you know, like those big titles, you need to know them very well and know how they operate in order to support them and work strategically with them. So I would hire people on a trial basis and go from there. It's Rome wasn't built in a day, and you shouldn't hire or you shouldn't hire quickly either. So
I'm curious about something. Sorry, Joe, real quick one. I'm paraphrasing you, Rachel. You said you had to fire your co-founder. What if the tables had been turned and your co-founder fired you?
So that actually did happen with my previous company. So I was fired from my first company, and I still owned 50% of the company, and we ended up settling. And yeah, I think that's part of business. But I think like creating value and being very clear in what value individuals must be driving and how this is meeting milestones, that's so critical. And, you know, like there's a book, I'm blanking on the name of the book, but the message from the book is, would you rather be king, or would you rather be successful? And, you know, and sometimes success says taking a step back and not leading as CEO, if that's what's best for the company. And I've always said, like, you know, if I'm not the best person to be CEO of this company, I would challenge somebody to come and step in my shoes and be intentional of who that individual is and what they would bring that I wouldn't. But that's something that does come up with the board. Not that they question my capabilities, but they're confident that I am the best person to be in this position for this company. So yeah, so that has come up. Long story short.
Thank you.
You're welcome.
Any last questions? Great. Well, thank you so much, Rachel. Thank you for all the insights and a lot of good lessons learned.
Definitely. Thank you. Thank you for the opportunity to talk and discuss, and nice meeting everyone today. And I definitely look forward to being on more calls and learning more about each of you.
Awesome. Thank you. Everyone, have a good night.
Thank you.